Hi everyone, my name is Nia Williams and my topic is insomnia. More specifically, insomnia and its impact on mental and physical health. I chose this topic because I struggle with insomnia and I was interested to see how my poor sleeping habits affected my mental and physical health. Insomnia is a sleep disorder distinguished by difficulties falling and or staying asleep. It is one of the most common sleep disorders and half of the population have reported having insomnia symptoms occasionally. Roughly 30% of the population suffers with insomnia, and 10% are dealing with chronic insomnia. It typically affects women more than men, and adults are more likely to have insomnia than younger people. There are a few types of insomnia. Acute insomnia is a brief episode of sleeplessness and usually goes away within a few days. There is no treatment needed for this. Chronic insomnia is a long-term pattern of difficulty sleeping. It usually lasts a few months and can be treated. Comorbid insomnia is associated with another disorder such as depression and anxiety. This usually lasts until you can treat and get the mental disorder under control. Onset insomnia is when you have difficulty falling asleep, but you are able to stay asleep. Maintenance insomnia is when you are able to fall asleep, but staying asleep is a problem. According to recent findings, insomnia is linked to low levels of a brain chemical called gamma-aminobutyric acid. People with insomnia have weakened neural connections to and from the thalamus. The thalamus is a part of the brain that regulates consciousness, sleep, and alertness. When it comes to insomnia, there are increased risks of mental health disorders and medical conditions. Medical conditions associated with insomnia are strokes, asthma attacks, seizures, weak immune systems, obesity, diabetes, high blood pressure, and heart disease. Mental health disorders that are caused by insomnia are depression, anxiety, confusion, frustration. With insomnia, there are increased risks for accidents. It can hinder your performance at school and or work, it can cloud your judgment, and insomnia can affect your memory. Insomnia is treated through cognitive behavior therapy, improved sleep habits, and medications such as sedatives, antihistamines, and antidepressants. Chronic insomnia is treated through psychotherapy and sometimes medications. Comorbid insomnia is treated at the same time as the underlying mental health disorder. This is usually done through therapy and medication for the disorder. Onset insomnia is treated with short-acting benzodiazepines and Ambien as well as therapy. Maintenance insomnia is treated with longer-acting medications such as clonazepam. Thank you for listening, and I hope you learned something.